was a good-looking young man, except that he kind of walked with a limp, and one side of his face kind of drooped. But even with that, he was a good-looking young man, 24, and I had started him on Seroquel for his bipolar illness because he hadn't taken anything for a long time. And I asked him why he hadn't taken anything for his bipolar illness for a long time. And he said, all the medicines made me sick. And really, there's nothing wrong with me, but I couldn't explain it to the other lady who was here before you because she got really mad at me. So I asked him what happened. And he says, look, I'll tell you the truth. When I came in here, I couldn't sleep. I had gone without sleep for days, and I was angry all the time. I couldn't concentrate. I couldn't do things. And I asked him, when did that start? How old were you when it started? Most of the time, bipolar will start at late teens, 17 or 18. And he was 24 years old, and he said it started 3 years ago, which is a little bit late, but that's possible. Some people start far later because something is wrong with some certain part of their head, or they've stroked or whatever. But I asked him, what did you do in your life when it started? Most people who go manic or depressed have a reason. And he said, well, it all started when I was working the night shift. And I asked him, why would a young guy like you work the night shift? I had seen his limp, and he had told me he was a cerebral palsy patient. And he says, well, one of my problems is I can't stand real long, and the other problem is that I can't work real far. And I've been going to these places like Manpower, looking for a job, because I'm done with high school, and I even did a little bit of college, but I don't feel like going on with college, so I went for a job, and all they have is working nights in the warehouse. My problem started when I was working night, and I couldn't sleep when it was light during the day. That's the only problem. And I said, what about it, what it says you're depressed? He said, it's pretty hard to learn to deal with the world when you have cerebral palsy and you don't look like everybody else and people think you're stupid. He said he had to learn some ways to do it and get some friends. And at college, he kind of started having friends, and he might go back doing it again. But he said, I was pretty depressed when I found out how people were going to treat me. But I'm okay now. I'm not going to get depressed again. And I looked at his medications, and this young man had had every medication I can think of for bipolar. He had been on lithium, the golden oldie from the 20th century, the 1950s, that puts on weight. And he said he felt it made him real sick. He got off that because when you have more weight, it's harder to limp around. And I'm noticing that every word I'm hearing from this young man is perfect common sense. And I said, well, why did people think you were bipolar? And he says, well, I guess you take care of sick people here. I said, yeah, mentally ill people, yeah. He said, so people looked at me and thought I was mentally ill. He says, you know how when you come in, the first person who interviews you is usually a young girl. She looks like she's still in college. I said, yeah, I know them. They call them clinicians. Some of them are interns still in college. But what about them? He says, well, they're the ones who put your diagnosis down, aren't they? And I said, yes, they are. It's a clinician diagnosis, but there has to be a separate diagnosis later from a medical doctor. And he says, well, I went into that older lady who's here, was in this office when you weren't, and she never asked me questions like you. He says, I can't believe all the questions you ask and how much time you spent. She just took the diagnosis the college lady wrote, and she kept on writing it again and again, and she never asked me questions. She said there wasn't enough time. In 3 years, he has been on every medicine known to me except Seroquel. He had been on lamotrigine or Lamictal. This medication is notable because it can kill patients. It causes a rash if the dose is raised too quickly. He had a rash, and from his description, it was not the kind of rash that kills people, but he got off that. He's also had rashes from risperidone and Abilify, 2 other agents originally FDA approved as antipsychotics that he was started on for mood stabilizers. And a rash is the initial indication of an allergy, and someone has to get off the medicine then. If they don't, if someone is exposed a second time, there is an increasing risk every time they get exposed of anaphylactic shock, of death, of the throat closing up. Luckily, he hadn't gone on to that. He said, I looked it up and figured out pretty fast, when you got a rash, you don't take the medicine. There he was, sitting in front of me. He said, the Seroquel you gave me was pretty good. And I said, I figured that the only part of bipolar you had was a sleep problem. And he said, well, that Seroquel really fixed me. So you gave me the right medicine, and thank you, but I don't need it anymore. Why wouldn't he need the medicine anymore? And how could he tell? Well, he said, you needed to fix my sleeping clock so I could start sleeping at night again. I haven't slept at night for a long time. The Seroquel made me sleep, but after 2 days it gave me a headache, and after 2 days, my sleep clock was reset. I don't think I ever had bipolar. I did have a sleep problem, but you fixed it. Well, the diagnosis wasn't anywhere, and I haven't even been able to get it permanently accepted by the computer yet. I'll have to try a couple more times. But sure enough, every time that he required by the computer to have a diagnosis reassessed, they put down bipolar illness again and again and again. Everybody for 3 years who had seen this patient had recopied the diagnosis. I think he was telling me the truth. I think the diagnosis was wrong. Circadian rhythm disorder is a perfectly valid diagnosis that's been found in the last couple of diagnostic manuals. People forget that deep down humans are animals. Just like the little animals in the forest who curl up and sleep in their hole at night, get out and get sun during the day, and go back to sleep again at night, we're made to function on a daily rhythm. We know a little bit more about it now. We know, for instance, in a latitude like California, if someone is exposed to the sun between 11 a.m. and 2 p.m., it makes their body secrete melatonin. Melatonin is a favorite cheap synthesis over-the-counter sleep aid. So what we do by getting this man to take something that makes you sleep, and Seroquel will make you sleep, that gets him through the night, is not only exactly what he said, but it's exactly the words that he said. You reset the clock. And once he was able to do that for a couple of days, he started sleeping regularly and became symptom-free. This is the standard accepted treatment for circadian rhythm disorder. It can happen to anybody who ends up working the night shifts. And as he did point out to me correctly, jobs are hard for anybody to get. They're hard to get for someone with cerebral palsy. He's a courageous young man, and he's going to make it in life. And he was willing to do something that no doctor in this picture was willing to do. He was willing to take the reality of his life and analyze it. When patients are seen in assembly lines, it's very easy for a doctor to fill in parts of the picture they don't see, to put the patient in a cubbyhole in a diagnostic classification where they continue to get services. So here he was sitting in front of me, and all he wanted was a job where he didn't have to lift too much. I thought of it, and I was, for a moment, ashamed to be a doctor and ashamed to work in that facility, because you get an honest, straight-talking patient who has been talking to, he had seen about 7 doctors over 3 years, and not one had heard what he said well enough to bring forward what I knew was a correct diagnosis. Well, I'm still trying to get it into that computer. I didn't think that would be so hard and so long. But if and when I do, he might not be eligible for services. Finding services is one of the hardest things of all. I wrote him down a list. When someone has cerebral palsy, they should get vocational services from the regional center. He saw a neurologist exactly once. He should talk to that neurologist. What can be done to strengthen his legs? He had never had physical therapy. I couldn't refer him for most of the things that he needed. I could only give him a list. And his voice is pretty close to normal. I mean, the partial palsy in his face did make his voice abnormal. He says, I use the phone well, and I have lots of time now during the day. I'm going to call them. He lives with his parents, and they're trying to help him. And he's going to succeed, not because of, but in spite of the shameful treatment given him by the state of California. First of all, for my beautiful institution and my beautiful doctors, he was given the wrong diagnosis and given a pigeonhole which will be very, very hard to escape, because he is listed as a seriously and persistently mentally ill person, although he has no signs, no problems that can't be explained by the simpler, truer diagnosis. So I told him while he's here to use the system, see if he can get some legal aid to help him get some Social Security, which he did not receive. Try to get him some helps through the system. Now the problem is directing him to those helps. Even within my clinic, where I was working when this happened, it was very hard for me to get people into the job assistance group, which I found out later wasn't that much of a job assistance group. Most people in it were not employed and were trying to learn how to pass interviews, which he had already done very well. I tried to get him an individual counselor. He was assigned, amazingly enough, the same woman who did his intake, who had told me recently she loved this job and was there until retirement. So we talked about ways to get around the system. I changed his diagnosis in the text. I'm still trying to change it in the massive computer system. It's getting bounced, I think, because someone who has this diagnosis would not be eligible for treatment. You don't get circadian rhythm treatment at County Mental Health or get paid for that by Medi-Cal or any other of the subsets of poor folks insurance that work here known to me. He's doing everything I said, and he's trying. I made an appointment for him to come back in a month to make sure he was still symptom-free, and he's going to make a few of these while he's still in the system and can use it as a springboard to other things. I can't guarantee the state of California is going to work, that it's going to work for this young man through his agencies. I told him the most important thing for him to do was to go to the office of his assembly person, the person who represents him in the California State Assembly. I told him to tell them everything I had told him. and he was taking notes. I wished him luck. He thanked me very, very seriously and gave me a hug. He's Christian. He wished me blessings. I regret that I am in a system that has damaged him as much as it has. And I regret that I am in a system that is offering him no single helping hand except mine. He's going to make it on his faith. He's going to make it on his ability to stay the course. I have nothing more to say about him. I wish I did.
Baby, I'm crazy for you. Baby, I'm crazy for you. Baby, I'm crazy for you.